Hi, everyone. Welcome to today's on-demand video, The History of the Health Center Movement and Considerations for Governing Boards. Our educator, Janice Sherman, serves as the founder and CEO of Partners in Equity, a nonprofit organization based in Atlanta. She has worked within and among the community health center movement for over 3 decades. As an expert consultant in the health center world, she and her team partner with healthcare and community leaders to advance equity and social justice via models that address the social drivers of health. Janice also assists community health centers and primary care associations with training and capacity building for diversity, equity, and inclusion initiatives. Welcome, Janice.
Well, thanks, Jenna, for that introduction. I am pleased to be with you today in partnership with HCAN to offer content that may help to frame a lens on health equity and social justice in your work. As someone who's worked with health center boards, as Jenna mentioned, throughout my career, today's content is from the perspective of the community health center movement, and we'll talk a little bit more about how we define that. And this topic is going to help us take a look at some of the program's history and offer consideration for how governing boards might include it in their work. And together we'll also explore through the lens of diversity, equity, and inclusion, how this work may be reflected in your service on the board. So thanks again for listening. And so as we establish context for what we consider the health center movement, I'd like to share that community health centers, for those of you who don't know, have been around in this country for over 50 plus years. They owe their existence to a remarkable turn of events that happened back in the mid-60s, more than 50 years ago. And this was at the height of the civil rights movement to really look at improving the lives of Americans, those living in deep poverty and in desperate need of healthcare. And during this time, we also had a group of healthcare and community leaders, much like yourself, working as advocates across the country. They were striving for the healthcare needs of access for all people, regardless of ability to pay, as well as a myriad of social causes like voting rights and housing discrimination, access to healthy foods, and things like clean water, those things we still see today. And so most of these organized activities and the momentum that spiraled and carried them forward are what we define as the community health center movement. And so for new and existing board members alike, we value the opportunity to share this work with you and look forward to your contributions as you're invited to extend this legacy of service. And I'd like to set the tone today a little bit with an introduction to a case study of a health center board that decided to do a specific focus on racial equity. And it's very helpful for us, of course, to learn from the work of others and consider examples of how we might shape our own calls to action. And this is really a powerful story of how one community health center's board came together and looked at their infrastructure to establish their capacity for diversity, equity, and inclusion work on the board. And while they focused on racial equity, you may determine your particular area of focus might be something different. And there are other case studies as well that we can tap into. This is the NAC Health Center Clearinghouse resource. This is one among others that are located within that body of information. And the website link is embedded here behind the clearinghouse label. And so with this slide, you have two options. One is you can scan the QR code right here on your screen with your mobile phone, and you can hit the play button to take a few minutes to listen directly, or you may consider taking it back to your board to view it together with fellow board members during your next board meeting to share the feedback and the thoughts together in that respect. And so what does this movement mean for health center boards? How you share the movement's history during your service on the board can have impact in moving forward the next legacy for a generation of leaders that follow you. The vision for community boards were that as patients, you would have a direct voice in addressing barriers and that you would be the voice of others in the community, that equity and justice would be a natural outgrowth of your work. And so these elements look at how the narrative of the movement evolves based on your contributions, how these barriers of inequity are reduced given your service, and your impact, and we'll talk about some of those examples, and then your voice as a 21st century advocate and the natural result of your work lends to equity and justice, as we mentioned. And so given that HCAN offers added support to equip you in thinking through how you might play a role, accessing these resources hopefully will serve you in framing your own discussions at the board level for diversity, equity, and inclusion. Here we think about looking at common language on diversity, equity, and inclusion. There are many different definitions that exist on this topic, even in our conversations with one another. So establishing a common definition of what these terms mean to you can be your own board's work based on reviewing sources such as these. This set of definitions is common in many searches, but you can determine the ones that are most relevant. As we think about these terms for your patients and the communities you serve, things like diversity, having a variety of social identities like race, gender, class, religion, and disability, migratory history, all in relation to how we address equity. Again, equity, which is distinguished from equality, and we'll look at that a little bit more on the next slide, is the notion of being fair and impartial and really looking at the individual and how they engage in your clinics. Do the policies that you approve acknowledge how everyone is afforded the same resources and the same treatment? And inclusion goes beyond just simple diversity and how we count people to ensure that there's a level of genuine participation among all. And then finally, health equity means that everyone has a fair and just opportunity to be as healthy as possible. The social drivers of poor health outcomes, as we know, persist when our patients consistently struggle with things like unemployment, poor housing, quality education, and transportation. As we think about the distinction, as I mentioned, between equality and equity, we all have an opportunity to lean deeper into an awareness of how all kinds of barriers have affected our society and the patients you serve. Equality means each individual or group of people is given the same resource as opportunity. As you see here on the left, the resources in this case being the stepladder is even. Equity recognizes that each person has a different set of circumstances and the resources are allocated to the individual needed to reach an equivalent outcome with the next person. Thus, everyone then reaches the same level above the gray bar. And so there we have the distinction between equality and equity. And how might we think about steps for governing board members to consider work that advances equity? Ideally, boards only need a couple of champions. Everyone is pretty much connected to the mission of serving all people, regardless of ability to pay. There's a compliance element that board members engage in around making sure that the program is up to the federal compliance standards. And for those of you who are new, if you haven't already gone through an operational site visit, that's where that comes into context. For those of you who have been around for a while, you're familiar with the compliance area of the federal site visit. And so finding champions, being able to really talk about things like poverty and race. And so affording time for dialogue as it relates to these issues will broaden your understanding of diversity, equity, inclusion, as well as justice. The journey of retaining the ability to share this kind of work authentically is really just that. It's a journey, but well worth the investment to deepen these conversations and see where you are as a governing board. The other element on the left of this slide really is familiar to some of us. It really brings into account that only 20% of what patients benefit from in the way of equity comes from their visit to the clinics. The other 80% are about all of these elements of housing, their physical environment, their health behaviors, and their socioeconomic factors. And so with the next few slides, they're pretty rhetorical, just really based on what I just shared about if you've been a part of an operational site visit, the federal government looks at how we incorporate things like diversity into the board's work. And so you may have seen these as it relates to compliance and health center governing boards, that your board composition truly reflects a diverse and equitable community in relation to those whom you're serving. I'll go through these just as a refresher of how the Health Center Grant Program considers areas of diversity, equity, and inclusion, or what we call DEI, in your work. And you can answer these questions rhetorically. How does diversity look on your board, and how the reflection of the community shows up in who you are? And then another element of inclusion really thinks about how board members have access to the same information, and to think about those questions as you're thinking about your next steps for this work and how you partner with your senior leadership to do that. This next one talks about board members all having opportunity to share their perspectives at meeting. And you may be aware of that, you may not be certain of that. Everyone doesn't always like to speak, but really thinking about ways of being intentional to ensure that there's equity across shared perspectives during your time of board convenings. And then this next one talks about periodically evaluating the support for your meeting structure to make sure that there is inclusion based on a definition that we included earlier in this talk. The earlier definition reflected that inclusion reflects more than simply diversity and counting of representation, and that it involves more of a genuine and empowered aspect of participation with a true sense of belonging and full access to opportunities. In this case, it may lead to committees or those who serve on committees or specific activities, and being able to do rotations of things like that to ensure inclusivity. So now I'd just like to move just briefly to think about strategic planning and how DEI, diversity, equity, and inclusion, could potentially intersect with strategic planning in your role as a governing body. This process typically considers a dedicated group of individuals on the board who are champions for ensuring that DEI is reflected in as many areas as possible, like strategic plans, like your needs assessments. And while this group can be separate from the board standard planning committee, there should be some overlap because boards are usually small and there's only so much of capacity to go around. And so just making sure that there's duplication in some of this, just to incorporate aspects of a DEI lens. And so here, thinking about if the board wants to establish a separate committee that may meet a couple of weeks during the year, first to propose that leadership share strategies with you to co-create some DEI objectives and outcomes, and then look at what percentage of, like for instance, what percentage of our newly hired providers and other leadership reflect our patient population. And so those are metrics that really say, if we're going to look at DEI, how would we measure it? And so things like that can help governing boards think about whether or not the organization as a whole is really looking at a lens of diversity, equity, and inclusion, and how the board really responds to that and engages around those issues. And so your role as governing board members is vital to the community health center movement. And we hope that you can forward the legacy of health justice and healthcare for all in considering things like diversity. How do we sustain the commitment for representation, as we talked about, that mirrors the community among boards as well as leaders? How do we consider equity in our roles as leaders that can approve things like personnel policies? How can we assure a lens for equity? Again, this is co-creating these things with your leadership, but it prompts some thoughts for you to think about where this might show up in your role as governing board members. And then consideration for inclusion, the power and the voice of the organization, as well as the members and the members of this board, for individual contributions where that's really warranted or desired. And then considerations for justice, the broader community voice you as board members can lend for change locally to improve things like education, or cultures of education centers around where people learn in different ways throughout the community, employment, where there are opportunities to support small businesses in your local communities and how the health center plays a role in that, as well as the board, and then neighborhoods and opportunities for the neighborhoods that surround our health centers to really survive and thrive. And so with that, we'll wrap up today's video, and thanks for listening, and hope that those concepts really add to your thought process and give you opportunities to go back to your boards and further the discussion. If you are interested in other opportunities where the board can really engage more on this topic, please feel free to jot down my contact info here. And thanks again for listening today.